Okay. Hi, I'm Martha.
Martha. My name is Ani.
Nice to meet you, Ani. Before we get started, I would like to go over
Nice
a
to
couple
meet you,
things.
Martha. Thanks for having me.
Of course, before we get started, I would like to go over a couple things with you. First is confidentiality. Confidentiality means whatever you say in this interview will stay between me and you unless I believe you're at risk of harming yourself or others. In that case, I will have to let someone know. Also, this video is being recorded and will be uploaded onto YouTube as an unlisted video. This means that only me and my professor have access to seeing it. Also, as a reminder, this is not a counseling session. This is a 15 to 20-minute interview. So please share only whatever you feel comfortable with. Nothing too emotionally heavy that will make you feel uncomfortable by the end of this interview. Do you consent and agree to this interview?
Yes, I consent and agree. Thank you for letting me know about the guidelines. I will be sure to treat this as an interview opposed to a therapy session. So I will not share anything that would leave me uncomfortable by the end of our meeting.
Sounds good. Thank you. Let's get started. So, today I'd love to hear about a meaningful transition in your life.
Um, Let me see. So a meaningful transition in my life. Um, when I think of a meaningful transition in my life, I think back to a time when I was beginning nursing school as well as becoming an aunt. So this was a few months ago, less than a year.
Can you tell me more about becoming an aunt?
Um, yeah, so it was my first time becoming an aunt, so I wasn't sure what to expect. And my sister is the one who was having the baby, and she also was not too sure what to expect because that was her first kid and neither of us had really spent very much time around children or babies. So it took a lot of learning and adapting, even from the day he was born. He was an emergency C section. So even from the start, it seems like we were having to constantly learn. Because for the C section, we had to stay in the hospital longer so my sister could recover from that. And the baby also needed a longer recovery than otherwise because he got a small cut on his face. So that needed to be monitored for signs of infection. And we just had to make sure the cut on his face closed and did not stay open. So, yeah, there's just been a lot of learning that has come with becoming an aunt.
Wow, it sounds like it was a um, very eventful for you. It must have been a little scary with everything going on with your sister having an emergency C section and, um, just learning as you go for not only you, also your sister becoming a new mom and you becoming a new aunt. Um, how was it the first time you held them?
The first time I held them was exciting because I had waited over 9 months to hold my nephew, though I was also a little bit nervous because that was the first baby I have ever held. So I wasn't sure what to expect. Like, would he wiggle a lot or is he going to start crying? And then we also had to keep him swaddled So also making sure that while I'm holding him, his swaddle is securely around him so he doesn't get his arms or legs out of there. And then also holding him, I didn't want to overheat him because he was already in his blanket and his outfit. And then with me holding him, he would get warmer. But luckily, my parents were there for the first time I held him. So they were able to give me some guidance on how to go about doing that. So they would just remind me stuff like making sure to keep his head up, like above his feet, and then also his beanie would occasionally slip. So they would help me make sure his beanie stays on and that his swaddle is around him and not getting too loose. And even setting him down, I also needed practice with that because that was new to me. So I had to just make sure to be very gentle with him. And then even setting him down in the car seat was a learning experience because I'd never used a car seat. And I went into that situation thinking that the hospital would guide us on how to use the car seat, but they did not because they said they are not able to help with car seats because they can't be liable for that. So I had to read the instructions and then watch some YouTube videos just to make sure I set it up properly and that he's fascinated in there safely. So it was an exciting time being able to hold him and learning how to do that. It was also a learning experience, though, as well as exciting.
It sounds like it was a joyful moment for you, but you also learned quite a bit. You learned how to properly hold your nephew, and you learned how to install a car seat and how to properly place him inside the car seat. So, how old is your nephew now?
Well, he was born in March 2025. So let me count March, April, May, June, July. Wait, what month are we in? June? Oh, yeah,
We're
June.
we're in June.
So he would be 15 months right now.
And did you guys celebrate his first birthday?
Yeah, we celebrated his first birthday um back in March. He was born on March 11th, so around that time is when we celebrated, and we had his celebration outside at our house because the weather was nice, and he had a good time. He enjoys watching people, and we don't have too many younger babies in our family, but he still enjoyed watching his older cousins play, and he would learn to play by watching them. And I wasn't able to attend the entire birthday because I was occupied with my nursing program. But my nephew enjoyed his birthday party and got a lot of new toys, like gifts and clothes that he has been enjoying.
Thank you for sharing that. It sounds like it was a very fun event for him and for the whole family. I would like to know more about your family dynamic and what does it mean to be an aunt in your family? Does everyone take turns taking care of him, or how does that work?
Yeah, we all try to take turns taking care of my nephew. I feel like when he was first born, it was primarily my parents taking care of the baby because my sister was recovering from her surgery. And then I was busy with my nursing program. And I also wasn't comfortable being left alone with the baby just because that was my first time with him. So later on, I did start to spend more time with my nephew because my parents would show me how to like prep his food or how to burp them or how to change his diapers and how to know what his needs are. So later on, also, I became his godmother. So that allowed me to spend more time with him because my family believes that the godmother comes right after the mom. So if my sister or my nephew's mom was busy and unable to take care of him, then it was my responsibility to take care of my nephew. And then if I was busy, and then he would be with my parents. So I would say initially, when he was first born, my parents did a lot of the caretaking. And then once I became his godmother, I was doing more of the caretaking than my parents. But we do all still watch him because he needs 24-hour care. So it's a lot for just a couple people to provide that. So we try to split the care between both my sisters and my parents and me. And occasionally he'll go to his cousin's house. So we get a lot of help with him, thankfully.
Thank you for sharing that. It sounds like you becoming a godmother, you take it very seriously, and you have learned quite a bit, just helping raise your nephew. Um, so if I'm hearing you right, it sounds like becoming an aunt has shifted you from being kind of carefree to suddenly having responsibilities for your little nephew. Does that sound about right?
Yeah, I would say that's about right. I've definitely had to prioritize my nephew more, and I'm not able to maybe go out super late anymore because I know during the nighttime, my sister would need help to watch him because sometimes she was in the shower and my parents were asleep. So I'd have to take the monitor with me in my room. So, yeah, I definitely had to spend more time with my nephew and prioritize him. So, yeah, you summarized that pretty good. You're a great listener.
Thank you. I also heard that you mentioned you started nursing school. Can you tell me a little bit more about that? What made you decide to go into nursing?
Yeah, so I did recently begin nursing school less than a year ago, and I was first interested in nursing school. I think it was probably around 2020. So it's been a few years since I was first interested in nursing. Around 2020, I took a anatomy physiology course through my high school, and anatomy and physiology is a prerequisite for nursing school. So that's what got me interested in nursing school. And also around that same time period, there was a pandemic. And through the pandemic, there was more talk about the need of nurses and how important it is to pursue a career in nursing. So that also impacted my desire to become a nurse. And there aren't any nurses in my family, so it was really just my high school's anatomy and physiology course, as well as the pandemic, that encouraged me to pursue a degree in nursing.
Thank you for sharing that. It sounds like that anatomy class really made a big impact in your life and it encouraged you to go into nursing. And when we went into the pandemic and entered COVID time, it sounds like that really encouraged you to become a nurse. You saw that there was a shortage on nurses and it helped you decide to become a nurse. Can you walk me through what the transition to school has been like? Has there been a lots of exams, lots of homework? Are you working currently?
I did not work during nursing school, though I did work prior to nursing school as an anatomy and physio tutor, though I was not able to balance work with school due to the demanding schedule as well as my previous tutoring job overlapping with my nursing courses. And it was definitely a big change to adapt to the nursing program because it's a lot different than the prerequisites. So um my class, or just one class, was worth 11 units, when in my prereqs my most unit course was 5 units. So that took some adjusting. And we had to go to clinicals for about maybe 18 to 20 hours a week. And we would start our shift at 6 a.m. So that also just took a lot of adjusting because I was not used to waking up at 4 a.m. And then the nursing exams also took a lot of adjusting because the way the questions work, they're multiple choice, but all of your choices are the correct answer. You just have to choose which answer is the most correct. So that was a little difficult to adjust to because in the prereqs, typically there's maybe one or two answers that could be correct, but only one's actually correct. So it's just been a lot different than the prereqs and has definitely taken some adjusting, like time management, also, especially because of my nephew, because sometimes I would have to stay up late with him to watch him. But then I would have to get up at 4 a.m. for nursing school. So just talking to my family and seeing who's able to watch him at what times so that we're all able to get our sleep and attend either work or school.
Thank you for sharing that. It sounds like you had to really find a balance between school, your nursing exams, and studying, and at the same time making sure you're taking care of yourself, getting enough sleep, and with your nephew, you were also helping out, and you really had to prioritize your time. Can you help me understand more when you say that your exams were um, all the answers were correct? Can you help me understand that a little bit more?
Yeah, that would essentially mean that maybe, for example, recently we've been going over electrolytes. So it would ask you what symptoms would you see with an electrolyte imbalance and which is your priority. So in your answers, each of those options would be something you'd see in an electrolyte imbalance, but the correct answer would be something that has to do with the either airway, breathing, or cardiac in your patient because you want to identify what could cause the most damage to your patient first. So I found it a little bit difficult because I wasn't able to eliminate as many answers right away because they were all life threatening to your patient, but maybe one was the most life threatening. Does that help clarify?
Yeah, thank you for clarifying that for me. It sounds like it can get overwhelming with your exams and all the like the new format that you had to get used to for the exams. I can relate to that. I'm currently taking some new courses in college, and they also do exams a little differently. But back to you, how did you manage to um, learn this new way of taking an exam? Was it kind of tricky at first since you were used to it?
It took me some time to get used to it. I had to look into how to be a critical thinker and just seeing which symptom would lead to what further symptoms. So then I can look down the road and see which of those symptoms would eventually lead to the most distress for my patient. So it definitely took a lot of adjusting because I wasn't quizzed on just vocab. I had to critically think about how my patient's condition would progress and how that would impact their quality of life.
Sounds like you adjusted well to it, and it made you a stronger critical thinker. I also heard that you started nursing school. So, how can you mention a little bit more about that? When you started nursing school, uh, was there ever moments where you felt like maybe you wanted to give up or you felt overwhelmed?
Yeah, I was very overwhelmed in the clinical setting, so the hospital, just because how I'm a student, I didn't have all the knowledge to help my patients. So, for example, it was common that maybe their oxygen was dropping. So, I would have to quickly find a nurse because as a student, I'm not able to administer oxygen because that's considered a medication. So, it was definitely stressful not being able to solve the patient's issue on my own because I was not qualified to do that. So just having to find somebody who was available was stressful because it delayed the patient's ability to properly breathe, which could later end to brain damage.
Sounds like it could be a little stressful in that situation where you are a student and you're learning as you go, and especially in nursing, very critical. Finding leaning on your supervisor or the nurses there seems like a great way to figure out what to do in case of those emergencies. So overall, I'm hearing two big shifts happening close together. It sounds like you becoming an aunt, which brought all this new love and responsibility. At the same time, you stepped into nursing school, which has been exciting but really demanding. That's a lot of change at once. How are you dealing with all of that together?
Um, well, I don't really have very good coping, so I just do it. I don't know.
That's understandable. Is there any times where you feel very anxious?
Yeah, quite often.
If it's okay with you, I would like to introduce you a breathing exercise. It's called box breathing. Is it okay if we do it together right now?
Yeah, let's do it.
Okay. First, I'll explain it to you and then we could do it together. So basically, box breathing is something that you could do before exams or whenever you feel really anxious. A lot of first responders and nurses tend to use this method. So first, you breathe in through your nose, you count to four, and you hold it for 4 seconds. And then you breathe out through your mouth slowly and you hold it for another 4 seconds. Okay, so does that make sense to you?
Yes, I'm ready.
Okay, let's do it together. So breathe in through your nose. Hold for four. One, two, three, four. Out through your mouth. Hold for four. One, two, three, four. Let's try it one more time. Okay.
Okay.
Okay. In through your nose. One, two, three, four. Out through your mouth. Hold. One, two, three, four. So how does that feel? How does that make you feel?
It definitely helped me feel more calm and present.
Thank you for sharing that. And again, you could use this anywhere. This trick is to slow your exhale, and that tells your body that you're safe to relax. Thank you so much for sharing all this information with me and sitting down and having this interview with me.
Yeah, thank you for interviewing me and teaching me about the box method.
Of course, nice meeting you.
Nice meeting you too, Martha. Bye.
Bye.